Hello, this is Askdefacto program. We will update you on COVID-19 situation in Mongolia by this, as we speak of date, November 24th by 2 o'clock p.m. This morning, the government made press conference, Minister of Health and the Emergency Commission. According to their information, we have total 32 cases added for last 24 hours, which made into 235 cases inside of the country disseminated. Total 672 cases in Mongolia. The remaining was transported from abroad. Well, there are two epicenters which added these cases, 3 in Ulaanbaatar and 26 in Silingaimak, the most northern Aimak with Russia at the border, and other 5 Aimaks, not any more additional cases for last 24 hours. But it doesn't mean that there is no cases, because on the average some 30 cases were discovered for last 4 days. So it still keeps going on, going up. So far we have these epicenters of coronavirus dissemination in Mongolia, along with the railways through Trans-Mongolian railways. So still the epicenters are under the watch. Well, there are also several thousand people want to go outside of Ulaanbaatar, and there are several thousand to come into inside, which are strongly forbidden so far. 27,000 people want to go to their Aimaks, and 11,000 people want to come to Ulaanbaatar city. For them, the government says there is a new application, a new website, 119.mn, where each of them should register their details, bio details, and they should go through 2 tests, PCR and rapid tests. And as soon as they come to their Aimaks, they should be in isolation either for 2 weeks. So altogether, you can imagine it's a big movement of people we talk about, which is expensive, of course, and the government is also afraid of losing the COVID-19 into the new areas, into areas where we have not so far identified any COVID cases. These are all Aimaks except those which is existing along the railroads. So the government also said that first time they are reopening one port of entry with Russia, which is in Bayingutgi Aimak, the most western Aimak of Mongolia, due to need of supply of food. You know, Mongolia 100% depends on Russia on food, and if we don't reopen that border, we will have a supply problem of food in the western Aimaks. So that's why they are opening it. The other borders, port of entries in southern border with China are all open, working as before, at the condition of COVID-19, of course, warnings. In Russia now, except this port, all port of entries are closed. Now the major issue in the country is, will this nationwide preparedness situation will be extended or not after December 1st? That's the question everybody is asking. But it depends, according to the government, it depends on the situation whether we will have any more additional epicenters or not. If we will not have, most likely they will lessen the situation and give you more traffic and more people's movement freedom. Now, the other question today is coming on the vaccines. According to the government, 20% of the population will be vaccinated by recommendation of WHO vaccines bought through UNICEF. The agreement is there, and this COVAX program allows Mongolia to buy cheaper vaccines. Another 20% of the population should be vaccinated with other vaccines, and the government is looking for any other source of vaccines, and meeting through diplomatic channels all possible companies, producers, countries who can provide these vaccines to Mongolia. The last concern now, people are talking about whether we have enough medical medicines or PPE for the country. And according to the elected officials, they say that medicines and we have so far sufficient supply. And interesting information was given on PPE, personal protective equipment, that they are producing inside of the country those products. As you know, they need to just daily to use that equipment, full protection, which is very heavy and very hard to be inside for more than several hours, which thanks to them, they do now many medical officers do every day. So that's so far update for you. And some information was based on the meeting of Parliament ad hoc commission related to the pandemic. Thank you very much. See you tomorrow.